Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Those who are uninsured or who have financial concerns about accessing medical care are slower to seek medical help when suffering a heart attack, according to research published in the April 14th issue of the Journal of the American Medical Association. It is important to seek medical care immediately if you think you are having a heart attack, because the longer it is untreated, the more likely permanent damage to the heart will occur. If a large area of the heart is damaged, full recovery is less likely. And the best chance for a full recovery will occur if you are treated within an hour of the onset of symptoms. Researchers from Tilburg University identified nearly 4,000 individuals who were treated in one of 24 U.S. hospitals for a heart attack between April 2005 and December 2008. Based on information available in medical records and structured interviews, participants were categorized as having health insurance and no financial concerns, having insurance but with financial concerns about accessing care, and those who were uninsured. Overall, 61.7% of patients were insured without financial concerns, 18.5% were insured with financial concerns, and 19.8% were uninsured. Those who were insured with no financial concerns were more likely to seek medical help sooner than those in the other two categories. While only 39% of those with insurance and no financial concerns arrived at the hospital more than 6 hours after the onset of symptoms, 49% of uninsured participants and 45% of those who were insured but still had financial concern took this long to seek medical care. On the other hand, insured participants without financial concern were most likely to reach the hospital within 2 hours of the onset of symptoms. We had a chance to speak with Dr. Paul Chan, one of the investigators of this study, who offered some further insight.
What we found was that a substantial number of patients in our study of over 3,700 patients waited a long time before coming in for symptoms of a heart attack. And in fact, about 2 in 5 patients waited more than 6 hours before coming into the hospital, despite the majority of them having chest pain. We know from prior experience in other studies that the longer patients wait to come into the hospital, the lower the likelihood that they could potentially receive life-saving drugs and therapies, such as clot-busting drugs for heart attacks and angioplasties and stents. The muscle that dies from a heart attack may be irreversibly damaged when patients wait more than 6 to 12 hours. We specifically found in this study that patients who had no health care insurance, or patients who had health insurance but had financial concerns about using their health care insurance, were more likely to wait more than 6 hours before coming into the hospital, despite having symptoms of a heart attack. Those patients who come in late are less likely to do well and will have more sustained damage to the heart muscle.
Today's research highlights the impact that insurance and financial issues can have on seeking medical care, even in emergency situations. For Insider Medicine in Depth, I'm Dr. Susan Sharma.